Meanwhile, India is also trying to safeguard its public from the deadly strain of the virus. The Ministry of Civil Aviation has ordered thermal screening of passengers arriving in India from China and Hong Kong. The screening has now been ordered at Chennai, Bengaluru, Hyderabad and Cochin airports, in addition to Delhi, Mumbai and Kolkata. The order comes in continuation of the advisory from Ministry of Health and Family Welfare and National Centre for Disease Control. The action has been taken regarding threat of the novel coronavirus that broke out in China's city of Wuhan. Let's now have a closer look at the action plan. The government has directed airlines to make in-flight announcements requesting passengers with history of fever and cough to declare so to state health authorities. Passengers who travel to Wuhan in the last 14 days will also be urged to declare it. Passengers will have to fill up the self-reporting forms before departure so that they can be reviewed upon arrival. Thermal screening of passengers will be undertaken, and airline staff would be responsible to bring the passengers to the health counters before the immigration check. All healthy passengers and crew members would be allowed to continue their journey. In case any ill passenger or crew member is confirmed as a probable case of coronavirus, public health authorities will be notified. Let's quickly get in some more perspective from Ground Zero, and for more information I'm joined in by our correspondent Patrick Falk, who's joining us live from Beijing at the moment. A very good afternoon to you, Patrick. Now, Patrick, National Health Commission in its briefing today has warned that the virus could mutate and spread rapidly. But is it not the containment of the epidemic that remains a serious challenge, since the first case outside Asia has now surfaced in Washington?
Yeah, that's right. This is certainly an international outbreak. To what extent it's a global health emergency, we're not quite sure yet, and we're going to be keeping a very close eye on that World Health Organization meeting that's taking place in Geneva to see whether or not they're going to declare it that and what steps they're going to be taking. One of the reports I read this morning said that there are going to be, or it's expected that there will be 1,300 travellers per day coming from China to Thailand. That's one of the countries where there have been confirmed cases. So that gives you an idea of just how much risk there is, particularly now that we know that human-to-human transmission is possible. And one of the things that authorities are really focusing on at the moment is trying to stop the potential spread in hospitals. One of the things that's really alarmed authorities is that there were 15 healthcare workers in Wuhan that were infected. So they think that there is some sort of a loophole in the way that they're handling patients, and we're not quite sure what that is exactly, but obviously they're being exposed to the virus and putting themselves at risk, so they're up in the training for them to try and stop that from happening, because, you know, the hospital environment is a potentially dangerous setting where this thing could spread further.
Absolutely. It is the containment, and as we also spoke about, the timing of the outbreak is, of course, very crucial, since we all know that the Lunar New Year holiday period is currently on in China. Now, according to a report in South China Morning Post, which quotes a latest study by Chinese scientists, this coronavirus is being linked to bats, which is also common to the SARS strain. Could this new study lead to a better understanding of the virus, hence a faster cure?
Well, look, one of the health experts I've spoken to has said that by identifying the virus, which authorities here have managed to do really quite quickly, within the space of 2 weeks since after it was first discovered. So that makes it easier to identify the source, and it makes it easier to identify carriers or people that have been infected, and hopefully that also means it's easier for them to find a cure. But as of now, they still haven't specifically determined what the origin is. As we know, it's suspected that it crossed over from animals to humans at this wet market in Wuhan, considered ground zero for this disease. But we don't know specifically at this point, and the big worry is there is no cure for the time being.
All right, so greater credibility needs to be attached to that study as of now. Now, Patrick, be it growing needs of a burgeoning population or intensive farming practices, will it be fair to say that Asia, especially Southeast Asia, is more prone to the threat of zoonotic viruses?
Well, I couldn't give you my personal opinion on that, but, there are a lot of people talking about the practice of, keeping live animals in wet markets. And one of the things that authorities have done is they've actually restricted, for the time being, bringing live animals into Wuhan at all at this moment. I can't say from a professional perspective whether or not the practice of keeping livestock in markets has contributed to any of this, but certainly it would seem as though that may have worsened the potential for this virus to spread, or as we know, one of the things that authorities are talking about is the potential for this virus to mutate. If it did indeed go from animals to human and then mutate to a form where it could be passed between people, of course that is a concern.
Right, Patrick, last but not the least, will today's WHO meet help in mobilizing resources to prevent the global spread of this virus?
Well, that's what one would hope. Already there have been travel restrictions that have been placed on people with flu symptoms in Wuhan. And there are a lot of things that are going on to try and prevent the spread, like preventing live animals from being brought into the city. Health authorities have also advised people not to go to crowded places, something that could be a little bit difficult at this time of the year when lots of people are going to be celebrating. They've advised people to wear face masks, and critically, people who are showing symptoms, they are telling them to go to hospitals and get checked right away. But, you wonder really if that's enough. As we've learned today, at least a dozen provinces have now got confirmed cases. So this has spread far beyond Wuhan within China. And, one has to question whether or not those sorts of measures need to be applied strictly all across the country, really.
Absolutely, and let's see what emerges out of the WHO meet. For now, thank you so much, Patrick Falk, for bringing us all those live details from China.